The hope is, if we're smart, whatever we do is we structure this thing in a certain way so that we provide prevention education, like you said, Sheriff, that we provide monies for treatment, that we provide monies for emergency response, drug courts, and other foster children, all those kind of things. What we don't want to happen is we don't want to just recover a bunch of money and then somebody goes out and fills a bunch of potholes with it or whatever. In other words, we want to think about this. That's why when I say we're using this as a model, this is why we're using this as a model. Because everybody's already working together and they're answering the question, if you got, pick a number. If you got $10 million, what would you do with it? If you got $20 million, what would you do with it? How would you spend it in your community? And I see that my medical examiner over there, she's already thinking about, I can hardly keep up with the autopsies I have now, and my instrumentation, she told me, and Julie told me yesterday, they're having to test so many drugs that their instruments are running 24/7. I went in there and saw them last night, and it's pretty amazing. But you need more resources to keep up with this opioid epidemic. So we don't know how much. We just hope it's enough to impact the opioid problem. Because really this is a mission, right? It's a lawsuit, yeah. But it's a mission. It's a mission to solve the opioid epidemic. Let me just say one other thing. We got a national public health emergency. You got 60,000 people that died last year. 60,000 people. That's more people from AIDS, more people than the Vietnam War, from the opioid epidemic, from the pill spill. So my question is, where is the focus in this country? A lot of people are talking about this, but I don't see a lot of, I don't think y'all got a check from D.C. yesterday for $20 million to help you solve the problem. My point is, we need to do something about it. This is one avenue. All these people are facing it every day. I'm up here, running my mouth. These folks are here, she's doing autopsies on dead people every day. He's arresting folks. They're preventing things. The chief's out, what the chief's doing, his people are doing? They're going out here and reviving people with Narcan. And they revive some of the same people over and over again. This isn't Florida, but Ohio, I just saw a statistic came out this morning. Last year they did 50,000 administrations of Narcan. 50,000 times somebody went out there and revived someone. I bet you in Florida it's 40, 50,000 administrations of Narcan. That's probably 25 or 30,000 people that would have died. Our overdose deaths would have been way up here. So this is a national emergency. This ought to be on the front page of the papers every day and on the top of everybody's mind. If you go where I went and see what she sees every day, every mom and dad in this community would be up in arms for somebody to do something about it. That's why I'm proud to stand here with these folks, because they are doing something about it.